Hey everyone, thanks for joining us today. We're going to talk today about Every Dollar Counts, Maximizing Denial Recovery. My name is Scott Everett. I'm the Vice President of Healthcare Solutions with Practical Data Solutions, and I'm being joined today by one of our account executives, Nick Rodriguez. Nick, thanks for joining me today.
Hey, thanks, Scott. Great to be here, and thank you to everyone for joining us today. For those of you who aren't familiar with PDS, we're a healthcare reporting and analytics company, and for the past 20 years, we've helped organizations around things like visualization, dashboarding, and data warehousing.
Thanks, Nick. So for those of you who were able to join us last month in our webinar, we talked a little bit about revenue integrity. And we showed this dashboard that you can see here showing how the technology today really allows us to combine metrics from across different sources and systems and be able to visualize kind of what's going on in the practice. Well, today we want to really focus on one aspect of revenue integrity, and that's denials. And again, what the technology really allows us to do is really easily kind of change focus. As you can see here, we have kind of the same thing, but denials has really jumped to the forefront. So if we've got a denials initiative going on within our organization, you can see it's actually very simple to place that emphasis there while still keeping kind of the same interplay among the metrics and showing what does the impact of denials have upon, say, like aged AR and what's still outstanding. So let's dig into this a little bit today.
So today's webinar is focused on denials, but we're going to use the PDS analytical strategy to understand different ways to apply analytics. So the first usage of analytics is for gaining insight, what's going on with our organization and what's the impact. The second usage for analytics is to support driving change. As we try to improve or correct performance, how do our analytical tools best support this journey? So with that, Scott, I think it'd be helpful to give a little background and spend a few minutes discussing what's changed in healthcare.
Sure. Obviously, there's a lot of changes which are really kind of driving healthcare today. Obviously, CMS has come out with their major changes for this year, which is really kind of dramatically impact provider reimbursement, and it really varies a lot between the different specialties that are out there. COVID has had huge impact on healthcare organizations all across the country, ranging from how we see our patients to patients maybe not necessarily coming into the office as frequently for elective services, losing or changing insurance because of job situations, and then of course with unemployment coming up, that makes it a challenge to collect self-pay balances. And really what this economy has taught us that we need to find reliable revenue streams that are out there. We need to make sure that we're being consistent and financially able to provide the services that our patients so badly need. And so with that, let's talk in particular about COVID and denials, because you wouldn't necessarily think the two go hand in hand. But as we've really worked with a lot of clients the past several months, we've seen that there actually has been a pretty dramatic impact that COVID has had on denial rates, ranging from the difficulty of collecting accurate patient information in telehealth situations. It's a little bit difficult where there are some payers who haven't necessarily approved all of these different services for telehealth. And so that's been causing some different denials that are out there. In addition to that, there are some inherent challenges coming from teams working remotely, both on the back end, maybe billing side, as well as payer staffs that are working remotely. It makes it a little bit more difficult to resolve these. So when we look at what's going on from those two areas, we can see that COVID actually really has kind of had a dramatic impact on denial rates, and we've seen some spikes as a result of that.
Yeah, so let's take a step back and talk about the impact of denials on revenue. So average claim denial rates are about 5 to 20%, but sadly, only 35% of denials are actually appealed. So digging a little deeper, recovery costs can actually reduce revenue dramatically. So it costs approximately $21 to file a claim, but the cost to follow up and resolve a denial usually run more than the filing of the original claim. And that doesn't even include if we get more than one denial on a claim.
So really, there's a big question in terms of just time value of money that's out there. When you look at it in healthcare, a lot of times it takes us up to 31 days or more to even get paid for a clean claim when it comes through. You know, when you add a denial into the mix, then all of a sudden you have to factor in the time it takes to get the denial back from the payer. You have to factor in the time it takes the staff to rework the denial, to gather all of the necessary information or documentation that's out there to generate an appeal appeal, and then you're waiting another 25, 30 days to see if that gets paid again or if it gets resubmitted or re-denied. And if that's the case, really when you think about it, a claim loses about 0.3% of its value from a time value of money standpoint each day that it's not paid. When you factor that into the fact and rework costs, it doesn't even really take 150 days before like a $100 claim with multiple denials becomes less than what it's worth in the collection costs. So understanding this, we have to really understand from a preventative standpoint, that's going to be our best bet. But what we're going to focus on today is we already haven't prevented these denials. We still have dollars that are sitting out there, and that's why these recovery efforts can be really important and critical to get there. So let's talk about what are the processes out there that impact denials. Really, everything we do from the office side of things, from the time we schedule a patient and register them and get their insurance verification, all the way down to making sure that we're doing accurate coding and charge entry, all of these things that we do can impact a denial, and making sure that we're as accurate as possible really helps with that. Nick, you want to take a gander at maybe some of the things that don't impact denials as much?
I've got nothing there. There really aren't any. Was that a tumbleweed or?
Yeah, sorry. I had marketing give us a once over last night. They can't stand the empty space, but yeah, it really does speak to the fact that from the time a patient calls to schedule an appointment to the time that we actually drop that first claim, all of these things are in our control, and we can either do a good process to help to make that better, or we need to change the way that we're doing things.
Thanks, Scott. So let's take a closer look at our strategy in the first area of using analytics for gaining insight. So first and foremost, we're really going to want to understand the problem, use our analytics to understand what's going on. From there, we can then quantify the impact. So we can quantify the problem in terms of things like lost productivity or cost. And then that actually helps us with gaining acceptance. It's much easier to drive change within your organization when people acknowledge that there is a problem. And once we've acknowledged that there is a problem, we can start visioning desired outcomes. How much can we save or gain by improving?
Yeah, so I think if we're going to start an initiative within an organization, this is a good place to start in attaining these acceptance. We also need to really understand by highlighting what are our key areas that are causing us problems. Now, as we've talked about kind of this new environment with COVID and all of the other changes going on, the most common denials that we're seeing out there are, a lot of it is within our control, from incorrect patient registration information. We're seeing some duplicate claims come quite a bit. And again, with these services not covered due to payers not approving certain telehealth services, these are really kind of where we start. And I think understanding our hot spots is a good place to begin.
Yeah, so let's take a look at your standard denial dashboard starting point. You can see we've got things like denial volume, prevention, and even denial recovery on here. Guys, is this still effective with all the changes we've discussed today, or?
Well, like you said, Nick, this is really kind of a standard dashboard that a lot of organizations use around denials, and it gives some good information in terms of the volumes that they're seeing, what are their efforts on a prevention and recovery standpoint. But again, it really is fairly informational, and it doesn't really dig very deep beneath the surface. If we really want to drive change like we were talking about, then we're going to have to dig a little bit deeper than what we're seeing right here. And I think the first place we need to start is really we need to tackle and get rid of a lot of the noise that comes in with denials reporting. And so really the first thing we recommend is you remove just those informational only denials. When we think about this, we really recommend a lot of times that people really recategorize their denial codes. And when they look at it, they categorize them into kind of a likely source of the denial. So you can see below, like, what's coming in because of registration errors and what's coming in because of billing errors. What is something that's maybe attributable to the payer, what's attributable to the providers, and what's even attributable to the patient. And then we need to study kind of the impact that has on our ability to rework these denials. So when we talk about high and low impact, what I mean by that is, what is it that's really within our control? What are the things that we can improve? And because those are in our control, those are usually the things that are the most recoverable because we have the ability to go and correct those errors. So those are things like registration and authorizations, And those are things that include communications that we have with the patients and just general accuracy within our coding and within our charge entry and payment posting, making sure that we're doing those things and finding out maybe where those errors have occurred really have made those types of denials a little bit more recoverable than the others. When we talk about low impacts, those are things that we may not have as much luck with, and those are things like medical necessity, maybe individual payer policies that require a whole lot of discussions with the payer, not even necessarily around individual denials. And so when we're looking at those are ones that tend to be less recoverable, or at least we're not getting the bang for our buck that we would get by spending a lot of time on those.
Absolutely. So let's take a look at using analytics to gain insight. So this is a web-based visualization where we can explore denial rates within each division. You can simply click on a division in the data filters. As you can see, we can start to understand denial trends, as well as, gain an understanding of the likely cause of denials, whether that be, registration or coding or whatever those causes might be. What I like about this dashboard is the visualization is interactive and really simple to understand.
What's good about this, like you said, is that it is interactive and that people can really get in and not just see what's going on, but they can dig a little bit. You see right away what are those high and low impact denials that are out there. And then once you even filter on something like that, you can start seeing who are the payers that have the highest level denials that are out there. You can see the key hot spots maybe within your organization when you look at the individual divisions or departments or specialties. And so really this interactability is something that the technology makes a little easier and again makes it a little bit better than those standard dashboards that maybe come directly out of the billing system.
Let's look beyond the current charts to understand if we're getting paid after the denial and see, what are we recovering. Using our analytics, I want to understand from the detail what's really going on. And because our tools are built using OLAP cubes, we can easily drill into the data in real time. Now you can see I'm in a cube, which is going to allow me to further explore the data by denial category. So you can quickly just click on things and it's going to explore that. And I can also continue to filter on by division or select a payer to understand, what are the main denial attributed to Blue Shield. So with a simple click, I can even drill into further detail. And, once in the detail, I can continue to do analysis until I understand exactly where the problems are. So, in summary, a good set of analytics should be flexible enough to gain insight. It's not about the dashboards or reports, but about understanding what's really going on.
Yeah, and what I like about something like this is what you just saw is in a matter of seconds, we were able to go from a dashboard all the way down to this individual claim level detail. When I'm in this detail, basically what I've just done right now is I've created work lists. And these work lists may be even more efficient to work than maybe what comes out of some standard queue that resides within the billing system directly. I can go through and I can identify these hot spots and I can send them out to the appropriate teams and not have to wait for what's necessarily sitting in a queue out there to begin with. And so that's definitely something that might drive some efficiencies within our group.
Absolutely.
When we look at it, again, it may be even more interesting to look at this from an individual provider standpoint if need be. And the way we can do that is, again, the technology makes it easy to look at very similar type metrics, but also look maybe a more granular level. And what this also allows us to do is to apply filters so that we can look at simply like source denials that are directly attributable to the providers so that they don't have to filter through the things that are maybe on the registration team or the coding team side. These are the ones that are really more provider focused.
Yeah, and we can see quickly that physicians in endocrinology, for example, have the biggest issue with documentation, and even taking it further, we can see that medicine, some of the physicians are having challenges with medical necessity, which is also, a source of denials for this group. We can quickly analyze which physicians are the biggest offenders and, where we need to focus our efforts in terms of, correcting that behavior.
And again, every organization is going to want these designs to be a little bit different and the focus to be a little bit different. But in the end, really the key type thing that we're looking to do is to create a narrative. And gaining insight at the end of the day, that's where we want to get to, is we want to be honest and we want to be transparent with what's going on in the organization. We need to be able to stand up in front of people and say, this is what happened. Our denial rates went up from 12% to 15%. Because of that, our physicians rate is directly attributable to this percentage of it. Our collection rates have dropped, our AR days are up, and our rework costs have increased. And because of that, because we didn't hit our target with this, it cost us an additional $384,000 in lost revenue. This is how we really gain buy-in and acceptance for changing the things that we do in order to improve. Now, this may not be the most effective way of showing it. It may be even more effective to put something like this directly in a dashboard. So if we look at a dashboard that's out there, we can actually, include some context that may go with it, where we can show the sources, we can show the impact levels, what is it that we can control, what are we not controlling. We can look at our rework costs down at that level, but again, we can include that narrative directly in this and make it very visible and stand out to the people who are looking at this.
Yeah, definitely. This is so clear and easy to understand, the impact of what's changed in our organization. You can't really miss that we lost $384,000 in 2020. Now that we've communicated the impact of the problem, let's start to understand where our opportunities lie to improve performance.
At PDS, we've created a number of dashboards that we refer to as performance opportunity dashboards. And what these are ones that we've developed around various areas in the revenue cycle. But what it's doing is it's taking the analytics and looking at things a little bit more predictively. And so what we're doing is we're leveraging the known. We're leveraging what we already know. We know our denial volumes. We know what our recovery rates are. We know what our denial rates are. So then we want to start modeling different scenarios against that, where we can say, what would happen if our rework costs, what would happen if we were to just see a 5% reduction in denials? What would that do to our rework costs? Or what would it do if everybody was performing at the division average? We can look at it from an improved reimbursement standpoint to say, what would happen if we were able to improve our recovery rates to a certain level to get that up? What if we put some effort in there? What are the opportunities? And a dashboard like this really highlights where our highest opportunities are. It's going to show us what activities we can focus on in order to receive the highest return for the least effort, so to speak. And so I think this is really a great place to start in terms of really attaching a financial opportunity for improvement and gaining that buy-in to change how we do things.
Yeah, absolutely. And, we can also look at the opportunities via the web. So this dashboard quantifies the at-risk dollars. It looks at the highest opportunities for recovery, and then it helps with prevention efforts to minimize future denial areas.
I like something like this as well, Nick, because again, like you talked about, you can see the at-risk because we know what our reimbursement rates are at various areas, and we can take it clear down to a procedure code level. And when we're looking at that, we can see where are our real hot spots, again, from a procedure standpoint. Is it our E&M coding, our surgical coding? What's our greatest risk, and where can we really focus our efforts? And that's where we want to place our resources if we want to maximize the recoveries that we can get to.
So, now that we've gained insight and gotten acceptance to vision outcomes, let's talk about using the analytic strategy to drive change. In driving change, we're going to design and deliver targeted analytics, help users understand their role in preventing and managing denials. From there, we're going to ensure leadership has focused reporting to manage effectively what's working, what still needs correction or, rework. And lastly, we're going to quantify the results at appropriate intervals. So, Scott, where should we start with targeting analytics for different types of users?
I think if we want to do this, the place where I usually like to start is I like to create what I call dashboards that tell a story. And so what you can see here is a dashboard that shows a variety of different metrics that are out there. And what we've done in this area is we've staged the data such that we're matching the denials against the charges that generated them. And what this is going to allow us to do is it's going to allow us to go in and calculate accurate denial rates. So we can see if the trend is going in the direction that we would expect. In addition to that, I want to then see what's going on after the denial. I want to see my payments that come after the denial. I want to see what was adjusted and credited off after the denial, and what's still sitting out there in active AR. This is what's really going to speak to me, and it's not even just what's sitting out there, but what's sitting out there that's had no transactions posted against it as of the date that the report was run. And so when I can see something like that, that's definitely going to show us what percentage of these denials haven't been resolved at all, and what can we do about that.
Yeah, Scott, after looking at this, it's pretty imperative that concentrating on your clean claim rate is key to denial prevention and, even increased cash flow.
Yeah, so if we want to take this dashboard then maybe a step further, we can then dig in and we can start looking at our sources that are out there. We can see a little bit with our resolutions in terms of payments and adjustments. But where we can also dig in is we can start looking at individual denial codes. One of the big mistakes that we see all the time when looking at recovery is that they tend to focus a lot on the higher balances that are out there rather than the most collectible balances that are out there. And so what a dashboard like this allows us to do is show us what are the particular denial codes that we get paid the most upon appeal. What are our payers that work with us the best on appeals, and who are the payers and what are the particular codes which maybe we aren't having a lot of luck with our recovery efforts that way. And so this is definitely something that can help us, again, really focus those efforts and give us what we need, give us information that we need to get the biggest returns.
Yeah, and as I look at this, you can tell that lag is tying up dollars that really should be hitting your bottom line here.
That cash flow really is pretty critical. I think if we were to take this, we could also look at this from like a payer's perspective, where we can look at it and we can focus on individual payers and start better understanding what's going on at these different payer levels. I think what you see is you see some graphs that look like they are in the other areas, but this is still definitely speaks to the targeted analytics. There may be some groups that want to see the same things, but the dashboard that you provide to maybe the payer team is going to be a little bit different than what you're providing to your front-end registration team or to your charge entry team. And so I think when you look at that targeted type thing, that's what really helps. Again, these are fairly simple visualizations to create, but you can really focus them in on where they want to go. What's really nice about the technology as well is as you can see here, we've got everything in one place. And so if I'm an executive leader or if I'm a supervisor that maybe covers a couple of different areas, I can really toggle through these reports and look at each one individually. Or if I just happen to belong to one individual team, I can really just go back and focus what's my particular area of responsibility and focus in that way. So this is what we talk about with these targeted analytics, is making sure that everybody has just what's specific to them.
That's a great point there. Having the right information for the right audience is really key. That being said, physicians can actually be a significant cause of denial. So let's take a look at a typical physician dashboard that is usually focused on things like RVUs and overall productivity. Scott, given what we've seen in our analysis today, how do we enhance this to help drive change?
Well, I think when you're looking at something like this, Nick, it really goes back and speaks to what we showed at the very beginning of this webinar, where we showed it's really very easy to make modifications to dashboards like this. So it's very simple to add a single metric even to a provider dashboard that can help the providers get engaged in the initiatives that we have. The providers can look right away and they can see red, yellow, green. Where am I performing well? Where am I really struggling? And what's an area that I may need to focus on before it gets out of hand? So looking at that, and then again, just focusing in on what are the source denials that are just directly attributed to the provider itself can really, again, help drive their engagement and helping them be proactive in helping us succeed in the initiative that we've set forth.
So we've looked at a lot of information and details around denials. How do we ensure that management, whether that's at the department level or leadership, quickly understand how we are doing?
Yeah, so at PDS, again, we've created a dashboard that we call our Quick Answers dashboard. And what this is we've heard almost universally in every engagement that we've been in that executives don't want to have to spend a lot of time trying to digest a bunch of numbers. They want to be able to look at a report and make quick judgments on what's going on. So you can look at something like a Quick Answers dashboard, and you can see we can focus it in on 4 or 5 different metrics related to this particular initiative. And they can see right away, are we meeting our goals or are we not meeting our goals? They can look at our trends see that our clean claim rate is trending in the right direction. They can look at our denied charges and they can see that there were spikes in the month of August, in the month of July, in the month of November that they may need to get people to look into and maybe get better understanding of what happened in those particular months. And then they can look right away and they can see that Blue Shield is our biggest driver of these denials. And so based upon that, that may be something that our payer relations team needs to look into. So really, again, matter of seconds, easy, quick judgments that are there, keeps the executive team involved, but it helps them to continue to drive the project and to ask the right questions of the teams that they're working with rather than simply trying to go in and get reports every month. They want to ask exactly what's going on and get what they need to know to be able to drive change in the right way.
And that top left section there really focuses the user. You know, it's hard to miss. Green check if you're doing well, red X if you're not.
Again, I think at the end of the day, after we look at this, the real key is we're still driving that narrative. We're still trying to provide a narrative, but you know what the executives really want even more than these easy-to-read dashboards is they want to be able to have the good part of the narrative. Narratives aren't always bad. Transparency isn't bad. We can start delivering good news. And so what's the great thing to be able to do is to be able to go back into the narrative that we have and said, okay, this has been our success this year. We've driven our denial rates down from 15% where it was to 11.3%. This resulted in $432 in additional revenues and cost savings that weren't lost because of denial rates. In addition to that, the initiatives we put in place around appeal efforts netted an additional $143,000 in recovered revenue. And so it's a great thing to be able to stand up in front of a board meeting and say, hey, guess what, everybody? We found for you an additional $575,000 this year through our denial efforts.
Yeah, and I'm sure if you said something like that in board meeting, you'd be very popular that day for sure. So in summary, when thinking about applying analytics to operational challenges like denials, instead of using a one-size-fits-all report, we found that dividing the usage of analytics into two key parts, one, gaining insight, and two, driving change is really beneficial. It allows for more focused design and implementation of tools that provide management with crisp feedback, timely results, and most importantly, actionable insights. At this point, I'd really like to thank everyone for joining us today. We hope everyone enjoyed the webinar and found it beneficial.
Thanks, everybody.
Have a great day, everyone. Take care.